All right, I'm going to talk about the thyroid today. I see a lot of thyroid patients. Most of them are hypothyroid and their TSH is high. So we're going to take a look at how this occurs. Just a couple of things, certainly not everything, but a couple of things that we can do to try to give nutritional support to the thyroid patient. So this represents the brain right here, and these two circles are right here. This is the hypothalamus, that's the pituitary gland. So this represents the thyroid. This represents the liver, that's why I have the big L here, and this represents the colon, okay? So the colon is where all your good bacteria is supposed to store, right in here. So what the brain does, the hypothalamus, the brain secretes to the pituitary many hormones, but one it does is thyroid releasing hormone. That's the one for the thyroid. That will cause this gland here, the pituitary, to go ahead and release what's called TSH. Now, if you've ever had, there you go. If you've ever had lab tests, it's likely they might have taken TSH. Now, if your TSH is high, that means you're hypothyroid. So the thyroid gland, because TSH, thyroid stimulating hormone, it causes the thyroid gland to release what's called T4 and T3. That's the abbreviations, T4 and T3. Now, 93% of it is T4, 7% of it is T3. So the body needs T3. This T4 is going to get converted. So 60% of the T4 goes to the liver here. And the liver is going to convert that T4 to T3. Now, if your liver doesn't have certain nutrients, it can't make that conversion. So if it doesn't have selenium, if it doesn't have zinc, copper, adequate amount of fish oil, it can't make this conversion. So if it's not making that conversion, the body's going to tell the hypothalamus here to secrete more TRH, secrete more TSH, because I need more T3. So what we need to do is get the liver healthy enough to make the conversion so it stops saying, send me more, and that in fact can drive TSH down. Now the second thing it does, 20% of this T4 is going to go to the colon. And the colon has all this good bacteria here. Problem is it's got bad bacteria too. So if we don't have a good supply of good bacteria, now everybody hears the term now probiotics. So when we take a probiotic, we also want a prebiotic with it, so it will cause it to multiply within the colon. And so we have more good bacteria than we do bad bacteria. And we have that, when we have that, 20% of this here goes here, and it will convert to T3 in the colon. But if we don't have that good gut bacteria, that doesn't occur. And so we have to establish. So what we're going to do is give nutrients for the liver to make the conversion. We're going to give a good probiotic with a prebiotic with it. And there's certain ones we use. We don't just throw a probiotic in. So we can reestablish that good gut bacteria so we can make the conversion. Because if you don't have it right there, you just lost 20% of your T4 that should convert to T3. And you're going to say the same thing to the hypothalamus. Give me more TRH so I can get more TSH so I can secrete more thyroid hormone. So TSH goes up. The highest I've ever seen is over 300. And so we need to give nutritional support. There's other nutritional support we do for thyroid. This is just a brief explanation of some stuff we do. Now what this is too, this is a great example of what we do with nutritional care. We're never treating a disease, gland, or organ. We're only giving the body what it needs so it can do the processes the processes it needs to do so we can get back to normal. That's always the goal with nutritional. Never treating a disease, gland, or organ, just giving the body what it needs so the body can function the way it's created to function. Till next time, reclaim your health, reclaim your life.